Welcome to the introduction of a quality improvement program that will change the way you view the community of tracheostomy-dependent patients. For too long, tracheostomy care and management has taken a back seat in the world of airways. Little to no education exists, and evidence-based practice is often scarce or even missing altogether. But it doesn't have to be any longer. After today's presentation, I hope that you as a facility, doctors, nurses, and respiratory therapists alike will choose to embrace the phrase tracheostomies matter as we begin a journey together to face fear through education. Did you know that tracheostomies were first mentioned in the Ebers Papyrus from ancient Egypt? When we learned about tracheostomies in school, it really was just a blimp on the radar of all those other really important things. And yet, as skilled critical thinkers, did you ever stop to wonder why an advanced airway didn't deserve a little more credit or even a little more time? Why weren't we talking about how to maintain them, how to keep the skin free from pressure sores, or even how to help people transition back to breathing without them? What in the world happened that we didn't learn that over 250,000 tracheostomies are performed a year in resource-rich countries around the world? Or better yet, why haven't we ever been taught what to do if someone with this advanced airway needs CPR? With all these questions, it's no wonder that so many nurses and caregivers are uncomfortable with tracheostomy care. But what if I told you you didn't have to be scared anymore? Tracheostomy is now obtainable right here in your own department. What if I told you that knowing and understanding tracheostomies could help lower your risk of being named in a lawsuit? What if I told you that nurses were the second most commonly named defendant in tracheostomy neglect cases? For nurses who see a tracheostomy even twice a month, wouldn't it be nice to know how to handle an emergency, when to consult the doctor or wound care, and if there was anything you could do to help your patient breathe easier or feel safer? Wouldn't you like to know that your patient's airway is secure? This is exactly what the tracheostomy total care protocol is made to do. The tracheostomy total care protocol, unlocking the mystery of tracheostomy care and management through a series of short in-service education modules and a certification of care after hands-on training and bedside competencies. By participating in the tracheostomy total care protocol training, you as a provider will quickly learn how to manage an emergency. You'll learn what items you need at bedside to support a positive outcome when emergencies occur, how to reduce risk while performing tracheostomy-related care, and even how to recognize risks before they become negative outcomes through the use of the tracheostomy risk assessment and evaluation scale. As you learn and navigate through the modules, you will find that the tracheostomy care is something that is manageable and that by performing the care task daily, you are reducing the risk for sentinel events as well as negative health outcomes that are oftentimes completely preventable. This is not just another computer-based program. It is integrated learning within your unit, hands-on training, side by side with your peers. Each participant will be able to learn, observe, and demonstrate their skills as they work towards earning the Tracheostomy Educator 1 certification. The goal of the program is threefold. 1, to educate nurses as a way to reduce negative outcomes. 2, to equip nurses and providers to become educators to others concerning tracheostomy care and management. 3, to apply the knowledge and skills through preparation, assessment, and evaluation. This last step will involve utilizing the TRACE scale, which holds the key to initiating nurse-driven protocols designed to address both minor and major concerns in tracheostomy site care and management. When tracheostomy site evaluation is missed in daily care, the risk for skin breakdown, pressure injury, and infections increase. These preventable negative outcomes can have long-term effects on your patient's health. Don't know anything about tracheostomies? That's not a problem either. Most nurses who assist in tracheostomy care have had little knowledge or training, and because of this, they find them to be scary and oftentimes intimidating. The tracheostomy total care protocol training can take you from Trach 0 to Trach Hero in a short time. The initial training session for Tracheostomy Educator Level 1 will require a time investment that includes a didactic intensive. This class will be created in a way to ensure that your confidence in tracheostomy care is clear so that you can return to your unit to educate others. The class is essentially your first step in certification that creates a clear definition of your tracheostomy knowledge. Once this certificate is achieved, you will be deployed to your unit to educate the nursing staff, demonstrate the skills, and do skill evaluations to ensure that each nurse is qualified to deliver evidence-based care to the patient with confidence. Don't let fear hold you back. As a facility, consider the difference you can make in the lives of your employees and their patients. Be the game changer in a tracheostomy care world. Be the trendsetter that brings the evidence-based practice where it belongs, to the patient, and make the commitment to provide excellent care through education and nursing skills. The Tracheostomy Total Care Protocol Training Program will 1. Educate nurses and caregivers on tracheostomy risks, care, management plans, and emergency procedures. It will provide information on tracheostomy surgical differences, tube types, sizes, and care procedures. It will discuss evidence-based practices as well as commonly used practices that are not evidence-based and alternatives that may be available. It will provide handouts for both medical and non-medical caregivers. It will demonstrate proper care techniques. It will provide time and instructor leadership opportunities for medical professionals to demonstrate their skills and discuss any and all adjustments that might need to be made to ensure proper care and patient safety. It will encourage nurse-driven, evidence-based management recommendations, such as HME use, speaking valve trialing, and patient-driven self-care. Last, it will establish a checklist for bedside tools required in a patient's room to ensure proper access during emergencies. This is a program that will advance your facility and nursing staff to allow for expansion into additional facilities once the program is established. The evidence is clear. Tracheostomy care matters.